Hello and welcome to Leaders in Education. My name is Colleen Casamasima and I am an implementation manager here at Quaver Ed. And with me today is Becky Haas. Becky, thank you for being with us today.
Well, thank you for having me.
Becky Haas is an international advocate and trainer on using a trauma-informed approach in communities and schools. Some of her work and accomplishments include co-authoring the Building a Trauma-Informed System of Care Toolkit for the Tennessee Department of Children's Services, and serving as the trauma-informed administrator for a regional healthcare system. Becky has been the recipient of numerous personal awards, one being the prestigious Friend of Children Award from the Tennessee Commission on Children and Youth, recognizing her as a state and national leader in implementation and support of trauma-informed services and communities. So Becky, first, can you tell us how you got started in this work?
Sure. Well, I was working for the police department in my town in Northeast Tennessee as a civilian. I was hired under a planning grant, and I helped to write a $800,000 crime reduction grant, which we were awarded, and then I was moved to be the director of that program. And what that program was designed to do was reduce drug-related and violent crime in two neighborhoods of our town, where that was the most historical type of crime, as well as reduce recidivism. And it was recidivism with felony offenders with addictions. So we ended up with 19 programs that 35 community agencies did together. But it was in that context that I heard about the childhood trauma and childhood adversity is not a small risk factor to addiction. I mean, it's 46 times more likely if a man has 6 events in his childhood that is traumatic, violence in the home, incarcerated caregiver, those kinds of things. But I wonder why nobody was talking about the role that childhood trauma could play in that cradle to prison pipeline. And so at the time in 2014, the Substance Abuse Mental Health Services Administration, or SAMHSA, they had a concept paper that said you should address trauma through an upstream approach of public education. Well, I've been a trainer my whole career, so I started writing trainings for the people around my public safety project, for teachers, for doctors, just researching what were best practices of using a trauma-informed lens. And I partnered with a psychology professor at East Tennessee State University. And on top of doing our day jobs, hers tenured faculty, me running police programs, in 3 years, we trained 4,000 professionals. And then things got really exciting in my career. I was recruited to the largest healthcare system in rural Appalachia, 22 hospitals in 3 states, to be their first trauma-informed administrator, to look at trauma, background trauma, because none of us pick where we start in life. And many individuals start in hard places. But the good news is that healthy support can make a difference.
So clearly, most of your work revolves around this concept of trauma.
Yes.
Could you explain a little bit more about what trauma is?
Sure. Well, SAMHSA defines it by 3 E words: an event, or a series of events that may occur, and then how you experience that event. So you and I could experience the same event, maybe a tornado or something like that, and I'm terribly traumatized while you're not. Well, what we know about trauma is that you had a healthy support system. Maybe you had a grandmother or mother that made you feel safe in the basement or where you took shelter. So there's the event, there's the experience, but then there's the effects of trauma. And so work that I do now in training teachers, training police, training judges, training doctors, is to help professionals to deal with the lingering effects of trauma and how it shows up in behavior. And we're really not after understanding people's trauma stories, though you'll hear many stories. But it's really giving professionals some new tools. You know, if the only tool you have is a hammer, you look at every problem as a nail. So I'm really out there helping professionals just have some new tools to be able to help trauma survivors thrive in their service delivery models.
So I think you alluded to this earlier, But a lot of educators now are hearing the term ACEs,
Mhm.
and adverse childhood experiences. Could you kind of explain how ACEs relates to trauma?
Sure. Well, the ACEs study that was conducted in 1995 to 1997, that really got the ball rolling on more conversation around trauma. So the ACEs study was conducted in California. Dr. Vincent Folletti with Kaiser Permanente, which is the largest HMO in California, and Dr. Rob Anda, who was with the CDC. Both of these gentlemen saw in their own medical practices, often it was coming up about childhood trauma, a patient that experienced incest or had a caregiver with mental illness, or maybe a family member navigating a physical illness for many years. And so they came together and created the original ACEs study, 10 questions. 5 things, did you see this in your home before age 18? Or 5 things, did this happen to you? And there are questions like, did you witness violence in your home? Did you ever feel you wouldn't have enough food to eat or a place to stay? Did you have a caregiver incarcerated? And what they uncovered, they never expected to find. And that was that when someone said yes to one question, then there was a probability there could be more. Then they found the higher the ACE score, 4, 5, 6, 7, 8, then these were individuals that it was very predictable were earlier introduced to mental health services, higher suicide attempts, and choosing more risky behaviors as children, going into alcohol, tobacco use, and drug addiction. And so they saw that on the negative side, that this could be a social determinant for poor health. They also uncovered that it could derail toxic stress. The ACEs, childhood adversity, could derail early child development. But on the other side, which is something that really makes me passionate about this work, is they found that though ACEs may be fact, they aren't fate. That what's predictable is preventable. And so a lot of the messaging I do is rather than thinking about building more jail beds or building more NICU for the NAS, drug-addicted babies born to an addicted caregiver, let's go upstream and support kids earlier on. And that's where educators have a huge role to play.
So, Becky, you talked a little bit about toxic stress, and some research has highlighted that toxic stress can affect a child's brain development. Could you speak a little bit to that?
Sure. And that is such a great question, and especially to an audience of teachers. And this is something that really teachers haven't known about, by and large, in their professional training, that when kids are coming into their classroom, that actually 2 different brains could be showing up depending on a child's background. So the 2 parts of the brain that are really important in the conversation around trauma and the adverse childhood experiences study is the upper part of the brain, the cortex, and then a lower area of the brain, a small gland called the amygdala. Now, the cortex is the part of the brain that a child needs to have developed to come into a classroom and remember facts and to engage. And there's other levels of the emotional realm, but by and large, the learning center is the upstairs brain, the cortex, okay? And then the amygdala is our fire alarm of our brain. So if while we're in this room, all of a sudden there's a snake that slithers across and we scream and jump for the highest point in the room, okay, then our upstairs brain shuts down. We really don't even think about it. It just shuts down. And then our amygdala takes over. But the problem with the amygdala, it's only capable of 3 types of actions: fight, flight, or freeze. And so when kids are growing up in hard places and don't have the brain development experts talk about it, it's called serve and return. And so in early ages in life, for the upper part of the brain to be developed, we need to have some kind of an activity that's going on with a caregiver, like a tennis game or ping pong match, where a child carries a toy over and shows the caregiver, and the caregiver names it letter makes the sound, and then in a minute or two, the child gets bored and goes to something else. That's called serve and return. And that has to happen for the upstairs part of the brain to be developed. And so when children are growing up and don't have any kind of serve and return, the Center for Disease Control says the number one form of child abuse is child neglect. So think about that if children are being left alone, and even sometimes we're put in front of the television, but it's that human interaction that helps a child develop a brain that's ready to go to school, to be able to thrive. And so when children are growing up in a home without serve and return, then what's happening is they're developing that amygdala. And so now they come into school with a highly developed fight, flight, or freeze, which is not going to be able to learn. So a typical brain development is an upside down pyramid with a little bit of scary brain, a little bit of the spider or whatever my grandchildren might see or whatever. But quickly an adult comes around and helps them to regulate, okay? And so then through trips to the zoo or books or playing together, then that child's developing the cortex. But in my own city, when I worked for the police, school board members told me that every year we had 300 to 400 children classified as homeless. Now, what that means to a school, it doesn't mean those children are sleeping under a bridge or in a car, but it means when a child leaves a class at the end of the day, the school has no permanent address for that child. And they're going to be moving around from couch to couch with a caregiver, and there could be drug activity involved. And so a child growing up in that kind of environment, their brain is developing like this, with a whole lot of amygdala, a whole lot of use of that survival brain, and a very little bit of the cortex. So now we have two students coming into first grade, and one is this brain and one is that brain. And that's why it's so important for teachers to know some tools and some simple strategies to bring into the classroom that can help the child with this brain turn it into this brain.
So you talked about this idea of kind of being upstream.
Mm-hmm.
So educators are part of that.
Yes.
Can you kind of speak to how prevalent is trauma in the schools today?
Well, more than I ever realized when I started this work, that 94 studies have showed 94% of youth and teenagers that are involved in the juvenile justice system have an ACE score. That 1 in 4 girls, 1 in 6 boys have experienced some type of violence before age 18. So it's very, very prevalent. And the thing with trauma and ACEs is that no neighborhood is excluded. When I worked for police, I often would see the call response information at the end of a day, and we would have children in certain areas of town where caregivers were arrested or domestic violence, but you would see really all over town that maybe some of even the high end of town, doctor and doctor, there's calls for, home domestic violence or partner violence or something like that. So it's very prevalent. Nationally, even with adults as well as children and youth, it's kind of about 70% of those that are on our workforce or are consumers. So in a school, it would be your children, are trauma survivors. So the thing is, in my generation, the Federal Disabilities Act that was passed in the 90s brought sweeping reform to help the service delivery model in every sector improve, where people with any kind of a lived disability, mobility or hearing, that kind of thing, could access services. And so when we think about 70% of our staff in a school, as well as the parents of kids, as well as the children themselves, then that's why this message is so urgent for teachers to understand. And I'm really excited to say that I'm working with several national colleges that, instead of just coming out now and training teachers once they're already in the field, that we're looking at ways to put it in their professional development so that teachers are going to hit the ground running, understanding the backstory of trauma in a child's life, and then have the tools to be able to help a child flourish in school.
So, with the number at 70% being that it's that high, um, how might educators see this present in a school setting?
Well, it's important to understand behaviors around trauma. Trauma's like the wind. You really don't ever see the wind. What you see are the effects of the wind. After a storm, you may see branches down or, shingles off of a roof. Well, that's the way trauma shows up. A few years ago, I was training 200 regional school nurses, and I'm going through behaviors of trauma, headaches, tummy aches, and all those nurses are shaking their head up and down. You know what a school nurse knows? Every year, they're going to have the frequent flyers into their office with a headache, with a tummy ache. And yes, it could be the headache and tummy ache, or it could be that Johnny or Sue or, Gwen is seeing hard things in the home. And so what we want teachers to understand with that prevalence of trauma is how that instead of looking at behaviors as willful behaviors, now we've introduced that there could be survival behaviors. So we have different things as far as physical manifestations of trauma, but then we also have emotional ones like anxiety or isolation, the kids that won't join on the playground and things like that. And then really what's huge in this are the behavioral ones, because when bad things happen in our lives, and all of us navigate hard places, but if you don't have healthy support system, healthy coping mechanisms, then one of the behaviors that shows up is that early age risky behaviors, teenage pregnancies, the cutting, the eating disorders, drug addiction, tobacco. And then we also have cognitive, which is really important for teachers to understand. You're going to show up with your best lesson, you've planned, you've been to a conference, you're ready to roll, but you've got kids sitting in there that are, their memory, they're somewhere else, and the cognitive abilities are not there, forgetting things over and over. And so instead of a child receiving discipline for that, I like to liken this training is handing you the glasses that you're able to see through the trauma lens. And when you see these behaviors, let it just plant a seed in your thoughts that maybe this child is experiencing some trauma.
So, Becky, you spoke before about how prevalent trauma is in the school setting. So, could you just go through some steps that educators might take to identify it in their own classrooms?
Sure. And as I mentioned before, I really encourage teachers and other school professionals to really use that universal precaution approach. Just really have an understanding that many, if not most, of the kids that are coming into your classroom, have experienced trauma. And as we talked about the brain development, when a child's got that upside down brain, the fight, flight, or freeze, then not to take personal those kinds of behaviors. Just realize there's a difference between willful behaviors and survival behaviors. And again, this information is so important to get out to teachers. Think about in the medical community, what if doctors, if there's better information, but yet they're misdiagnosing a disease. And so maybe with a child, instead of some sort of a disciplinary response, maybe instead they need a nap or a trip to the counselor's office, okay? So teachers really just need to go in and understand it's very important to create an atmosphere where children belong. I've heard stories in my career and this is a sensitive topic, of children locked in closets at night around caregivers' activity, children that might be violated by people that come in the home around particularly drug activity. And so, when a child comes into school, they may not have a place where they feel they belong. And so by creating that sense of a belonging, so some of the schools, what they do, and just doing some of the different strategies and helping kids belong, helping them have a sense of mastery that is strength-based. What do I do good and all? But some schools, though, they create a system where kids can come in and check in with somebody, where a child gets off the bus and comes in and talks to their check-in teacher for just a couple of minutes. And the teacher's able to say, oh, you wore your red shoes today. And, just something very simple. And sometimes it's hard for us to wrap our mind around a child having no one at home that knows about their classwork. Maybe no one. I've worked with school principals that have children in their elementary school that all come from a housing authority. And the day I visited that principal, she showed me a hedge out on the playground. And she said, Becky, about 7:30, they'll start coming through the hedge barefooted in their pajamas. And they're not necessarily coming in because they're excited about school. They're excited about breakfast. And so teachers need to realize that when children are growing up in hard places, they are the greatest buffer to help a child, begin to thrive in learning. And so really just to understand there's going to be a high prevalence of this and not to take those behaviors personal, to learn about some other strategies that we're going to be sharing about, and just helping children feel they have a sense of belong, that we're excited they're here. And I use a technique often called 2 to 10. A teacher who writes a blog for many years, she was where I read it, and she said, I'm reluctant to ever share things that I call miraculous, but she said 2 to 10 is about as close as it comes. And so when I'm training teachers and we talk about 2 to 10, you take kids that might be the most at risk, that maybe you are aware of some difficulties, or maybe without knowing stories, that maybe they're struggling, okay? You see a lot of that fight, flight, or freeze. Well, the next 10 times you see that child, just give them 2 minutes to talk to you about whatever they want. Don't have any questions or an interview. What are you doing? You're creating connection. And one of the greatest things that teachers and bus drivers, school cafeteria, custodians can help bring to the school is creating a sense of connection.
Thank you for sharing those ideas that can be very impactful for educators. And thank you for being here.
You're welcome. I've enjoyed our conversation.
And thank you for tuning in to this episode of Leaders in Education. Each month, we will bring you relevant dialogue with educational leaders and subject matter experts. Our mission is to create an opportunity for educators to engage in meaningful professional learning and collaboration alongside other educators nationwide. Please join us next for the second part of this important discussion. In part 2, we will take a more in-depth look at creating trauma-sensitive schools with our guest, Becky Haas. You can find part 2 of this discussion now on our website at quaverette.com.